report. I've been here almost 5 years.
What a great lineup. Thank you so much, Dr. Himmelhoek, and everybody present on the stage today. So I'm really excited about getting into this discussion. So let's go for it. So we will talk in the order in which the panelists are seated. This was by design. Yes, it was. So let's just do that. So we want to start out talking about Clinica Amiga and how it meets the needs of a growing community. So Clinica Amiga was founded in 2019 to meet the needs of Kentucky's growing Hispanic and Latinx population, to ensure that language, and I want to repeat this, to ensure that language does not impede quality treatment. This pediatric primary care clinic located in Kentucky Clinic South employs bilingual providers who are sensitive to the potential language and cultural barriers to care. So today, Dr. Ceballos will tell us about what she is most proud of as it relates to the meeting the needs of the Hispanic and Latinx patient population, and what are some of the critical next steps to allow us to continue to meet the needs of this population over the next several decades.
Within the Department of Pediatrics, as you said, we created Clinica Amiga in 2019, which is Spanish for Friendly Clinic, and it's a pediatric medical home for our Hispanic community within the General Pediatrics Teaching Clinic. With the support of Hispanic and bilingual staffing providers, we successfully bridge the population's language and, most importantly, cultural barriers, providing high quality and comprehensive pediatric care. For the last 5 years, too, we have run Un Abrazo Amigo, Spanish for a friendly hug. It's a family support group in Spanish for Hispanic families with children with special healthcare needs. Besides providing health education and social support, Un Abrazo Amigo serves as a community outreach liaison for our Clinica Amiga, our pediatric medical home, helping our patients and their families meet their medical needs. We also have worked for the last 3 years in collaboration with Radio Lex, our local community radio station, on health education to our Hispanic community with monthly educational programs in Spanish and the production of Clinica Amiga podcast, which is available on our UK healthcare website. During the initial portion of the pandemic, we were a present voice of education to our community about COVID-19 and its constant information changes. We have worked directly with UK healthcare marketing, improving the visibility of our services to a Spanish-speaking population, creating a bilingual website for our specific services at Clinica Amiga, and also supporting outreach activities in the community. And our Department of Pediatrics also comes with a direct Spanish phone line, supporting our families with communicating with providers and access to services. We work very closely with our UK Healthcare Language Interpreter Director to ensure that all our services, clinical and community outreach, have interpreters available when in need. Now, regarding your second portion, I think the critical next steps to allow us to continue to meet the needs of our Hispanic population is to have a conscious strategic plan to expand our current programs to better meet the demand by first creating a tailored medical home to the Hispanic community with specific space and resources where the community can feel comfortable and providers they can identify with can effectively address the cultural and social barriers to access healthcare. Second, I also think that we should expand our community outreach, health education programs, and marketing services directed to the Hispanic community in bilingual formats. And third, continue towards UK healthcare workforce to reflect our evolving population demographics.
So thank you so much, Dr. Ceballos. So in that, and just to kind of summarize this is so much great information through Dr. Ceballos' leadership, physician leadership. I love this, that we have the bilingual speakers at Clinica Amiga, but it sounded like you had also talked about the family support group, which is a great thing. That was one of the things Dr. Ceballos mentioned. And the fact that we have a radio station through Radio Lex to communicate with individuals at a very challenging time. And when you talk about COVID, we know how alienating and isolating that was. So imagine when you're limited and also maybe having limited English proficiency when everyone around you is speaking English. So these are some really, really great things that Dr. Ceballos and her team have been able to accomplish. And I just want to applaud her for that and just kind of lift up the fact that when she talked about the very same things that Dr. Newman talked about, that as we move forward for the next 60 years, we have to be strategic, we have to be inclusive, and we have to be intentional. So there's a lot of intentionality when Dr. Ceballos talks about the things in our next step when we talk about a medical home for the Hispanic population, for expanding community outreach, but also looking at how we represent at the bedside, how we look, how we talk, and our ability to communicate with our patients. So thank you so much, Dr. Ceballos. So now I would like to shift our attention a little bit and talk about the presence and the power of community power building. So today we believe that our success in the future hinges on our ability to build connections with the community. To journey along with the community, we will include, of course, leaders, advocates, and simply with the people to create a healthier Kentucky. You will hear about various programs as our leaders and our experts talk to you today to meet the needs of populations who have been made vulnerable through under-resourcing. But we also must have the conversation about how we meet people where they are. Right? Meeting people where they are. So Dr. Conwell is going to talk about the power of presence in the community. So Dr. Conwell, talk to us about the vision you have in Black and brown communities, looking at African American churches, cancer screening, and share a little more about how we can start building power relationships in the community.
Thank you, Dr. Talbert, and I'm really excited to be here. I mean, this is really a great opportunity for all of us to talk about what we are really passionate about, and it's one of the reasons why I came to the University of Kentucky to work with UK Healthcare and the College of Medicine, is to really make a difference, and I saw the opportunity that we have here. So we're going to talk about some of the things that we are addressing. You heard some of the value-based metrics that we're going after in our communities. But specifically for me right now, I'm really going into the African American and Black community, our brown and Black communities, and what can we do to help them with this care gap that was mentioned earlier in our conversation. So we believe these gaps are related to social determinants of health. We also know these gaps have some modifiable risk factors like obesity, diabetes, hypertension, things that we at UK Healthcare care about. We are addressing in our primary care clinics, in our pediatrics clinics. We're really trying to make a difference in the lives of these patients because we can modify their risk. We can decrease their chances of developing cancer. So I want to focus on cancer right now in these communities. So one thing that we've done is we've partnered with the Kentucky Cancer Program, and they're affiliated with the Marquis Cancer Center, which we obviously are really passionate about and what they are doing throughout the entire state of Kentucky. We're also partnering with the National Pancreas Foundation. I'm a member of the board. This is a nonprofit organization that's going after pancreas cancer and pancreatitis. The last thing we were doing is really going to be working hard to address colon cancer in our community. It's a big killer of African American patients. There is a very high risk of developing these cancers in our community. But like I said, modifiable risk factors, things that we can do as healthcare providers to make a difference and really turn the tide and change the outcomes in patients. So I'm going to give you a couple examples of some things that we've done since we've been here for the past 7 months. We've gone to First Baptist Bracktown Church. They had a breast cancer awareness day at their church, so we called the Kentucky Cancer Program, talked to Khadijah Wallace, who's their community worker, and she instantly came and set up a table and gave out information to that congregation after church on breast cancer awareness. So all of this is really about engaging the community, educating the community, which is going to empower them to go get the care that they need. Another opportunity that we had was with our Barnstable Brown Diabetes Center. They had a health fair. And so my wife and I, we've been doing this for years, we're now in a different location, but the message is the same, which is we need to engage our community and help people understand their risks and how we can impact their outcomes. So this was a health fair, And at that time, we decided to use the National Pancreas Foundation information on pancreas cancer. A lot of famous African Americans have died of pancreas cancer. Dizzy Gillespie, Aretha Franklin, one of the Neville brothers. So this is something that impacts their community, and they're aware of it. But what do we do about it? Well, we have to treat their diabetes. We have to lose weight. We have to improve how we eat. So they need this education to empower them to make those changes. The last thing we have done is we've also worked with the National Pancreas Foundation, and we did a webinar on YouTube. I moderated that webinar. I was so excited to be representing UK Healthcare as the moderator of that, and you can see that on YouTube. And we talked about pancreas cancer, pancreatitis in the Black community. It is 20% higher in the Black community. You're more likely to have advanced stage 3, stage 4 cancer when you present with pancreas cancer. So this is a very important message that we wanted to inform people about. So it's an exciting opportunity for us to be here. There's a lot that we're going to be doing, and we're just getting started. I just really want to thank Dr. Newman and all of the leaders here for their confidence in my recruitment here to really come and impact our community and really change the landscape here in Kentucky. So thank you very much, Dr. Talbert.
Yes, wonderful, wonderful, wonderful job. That is just, I love the fact that we're talking about engaging and educating the community for empowerment, right?
Yes.
I mean, teaching people how to be and create a healthier Kentucky. So I just really like that enthusiasm and some of those ideas, and the fact that, okay, Dr. Conwell has been here for 7 months and he had to talk about 2 events he's already conducted. But that's okay, no one's counting or anything. No, but I love the energy, and I think that I believe that it will take us far, right, in terms of looking at UK healthcare and working in our communities. So thank you so much. And so next, I would like to go to Mr. Gilliard, and we're going to focus a little bit on workforce and recruitment of top diverse talent. So as part of our journey forward, we would be remiss if we did not talk about the power of representation at the bedside. And Dr. Ceballos eloquently stated this in her great dissertation as well on what we're doing in the Hispanic community. So if we didn't look at representation at the bedside amongst our staff who work face-to-face with our patients, right? But also the representation at our executive team levels and team and leaders. So if you will, Tim, share your vision of how we might move forward with recruitment of top diverse talent and why it's important.
All right, thanks, Dr. Talbert, and I'd be happy to share my vision. But before I do that, I want to bring some value to something that Dr. Newman said when he was talking. He said, diversity is our top value. I'm not sure most people here at Kentucky understand that, and I'm speaking from a minority executive who's been in the field for 32 years, have been to several organizations, and one of the first things we minorities do is we go online and see, are we going to fit at that organization? Are we going to be accepted? And I have to say, one of the things that people at the UK Healthcare don't understand is this is one of the few, and I think the only that I've found, that actually has diversity as the first value listed. Most organizations, and go out and check it, will have diversity as the last value. And that's one of the things that really attracted me when I saw that, and really wanted to be a part, like you said, be a part of this community and to come here. So as far as my vision for attracting top minority talent or diverse talent, I would say that my vision is that we become more deliberate and work more with a sense of urgency in diversifying our organization. And some of the more deliberate things I would suggest we work on is to create more diverse candidate pools in our hiring practices. I've had the experience of working at a previous organization that would not allow you to move forward with filling a new position or an existing position unless you have demonstrated that you've exhausted all efforts in creating some diversity in the candidate pool. Now, that's not to say that we always hired the minority candidate, but at least it gives you a chance to have offered that position to diversify your organization. Other areas that I would look at, well, my vision would also be that we diversify our pipeline feeding our employment here at the organization. That would be in areas like physician residents or administrative fellows, MHA students doing their internships here, MAs, technicians, or as we partner with high schools and middle schools and mentorship programs. We have a 2-year fellowship program here that we could target minority, newly graduated MHA students to train to be future health administrators. This is, I think, our organization, a large organization like this, is an excellent training ground for both inpatient and outpatient management training and administration. As we look at physician residents, I would think that if someone matches and comes to work here at UK, that we would start early to put in an extra effort to try to retain these people to stay with us at the end of their training. Now, a lot of that might require creating programs like affinity groups to where we introduce people of like backgrounds to each other so they can support each other as they navigate through our environment. So several organizations are trying programs like that in the areas of affinity groups, which tends to help people feel more welcome. They can discuss issues they may be going through and then understand them better, so forth. So those type of things we should look at as well. We should also, I mentioned middle school and high school students. So we need to start early. Now, I currently spend a couple of hours just about every Saturday working with a large group of 6th through 12th grade minority males and helping them improve their grades, as well as introducing them to several or their career options going forward. Now, to be honest, since I'm in healthcare, my bias is healthcare, and those kids will tell you, every weekend this guy comes out here and asks us, hey, what do you think about healthcare? But I try to push that with them and plant that seed early. And I believe it's starting to catch. Dr. Conwell is familiar with this program. He comes out a couple of times a month to run a program on more specific clinical topics, and the BAM program. So those are some of the things that I would see as my vision to try to attract diverse talent in our organization.
I love it, and thank you so much. And what I heard you saying is the deliberate nature of what we need to do and the sense of urgency. Is the time is really now, and we have to take advantage of that and be very intentional, as Dr. Newman had mentioned earlier. So intentionality, strategic, and inclusive. We just have to keep those things at top of mind. So thank you so much for those great comments and that feedback, Tim.
Thank
and
you.
So we've talked a little bit, obviously, about Clinica Amiga, and we've talked about our presence in the community, and we've talked about the importance of representation at the bedside. So now I want to shift a little bit, and we're going to have Nancy Garr talk a little more after I finish here about Polk Dalton, because Polk Dalton came to be for a very specific and unique population that was under-resourced on the east side of town. So in 1996, when UK Healthcare opened the Kentucky Clinic North in downtown Lexington, the goal was to provide access to an underserved community. The clinic sought to further to pioneering work of 2 African-American physicians who served in Lexington in the early 20th century. So one of these physician Dr. John Polk, who was of Midway, Kentucky, established his medical practice in downtown Lexington shortly after graduating from a historically black university, Howard University, in 1918. Polk later founded Polk's Infirmary in 1920, where he provided routine medical care, minor operations, and overnight supervision. Polk was a highly accomplished surgeon, and he was one of four. So this just look at how far we've come. One of 4 black physicians with operating room privileges at Good Sam and St. Joe. here in Lexington. So more than just a medical facility, Polk's Infirmary served as a gathering place for Lexington's African-American community. And then around 1940, Dr. Dalton, Rufus Dalton, reopened Polk's Clinic, directing the clinic until his death in 1953. And so in 2008, UK Healthcare rededicated Kentucky Clinic North as Polk Dalton Clinic in honor of those two physicians. So, Ms. Nancy, my question to you is, tell us about the population that we serve at Polk Dalton and what we will need to do as we move forward to continue to answer the call for individuals who have been made vulnerable due to under-resourcing in our community.
Thank you, Dr. Talbert. As my fellow colleagues and panelists have discussed, we're here to talk about that critical conversation that is a lot of times hard to discuss, given the background and the history of the Polk Dalton Clinic. Our clinic has the spirit of the founders, Dr. Polk and Dr. Dalton, in meeting the clients right where they're at. Being a community-based, hospital-based clinic has the luxury of providing a variety of services that are offered throughout UK healthcare. And having said that, we not only identified and have primary care providers, where we have internal medicine, med-peds, OB/GYN, an international clinic. We also have the capacity and the capability to do x-ray services as well as have full lab services on site. You say maybe that's not unusual for a primary care provider site to have those things, but being in the community, we have identified over the past 14 years that there's more to meeting the client, not at the bedside, but in where they live at. And historically, when you look at a definition of a community health worker, a community health worker is someone who lives, works, breathes, and is part of the community. Well, we had done our research and looked into it, and we have a certified community health worker who works and does what we call the front porch effect in having the clients and meet the clients at their needs. Now, historically, they have gone to, community health workers may meet clients and go to their homes, but no, with the front porch effect, they can come to us and they can feel comfortable because our community health worker is from the community and lives right up the street. She is connected and has the ability to help us bridge the care gaps. So it helps our providers as the providers are trying to go over the health plan and what the needs may be. The providers can do what we refer to as a soft handoff to the client, to our certified community health worker, to just assure that they understood what is in that treatment plan. Do they have the resources that are necessary? Talk about the things that are specific that they may have to do to deal with some of the social determinants of health, or is there a transportation issue, or did they clearly understand what was said? Because they may have low literacy. So having our community health worker is one of the programs that we developed in the past, bringing us to the future, as well as health literacy. When you're looking at children, the nearest library, which is the Eastside Library from the Polk Dalton Clinic, is an hour and 54 minutes, according to Google Maps, on how to walk and get there. Or if you're doing it by car, you could say it's 15 minutes. But when you have an underserved population and meeting them where they're at, the Polk Dalton Clinic has developed and tapped into a nationally known program known as Reach Out and Read, where the provider provides a book at age specific during the well child check visit to ensure that that mother has the tools necessary, or father or parent or grandparent, to be able to help educate the child. And they're geared specifically to the needs for our various communities. We also meet the community where they're at by having and support back-to-school physicals as a requirement for the Kentucky. For entry in school, you have to have vaccinations, and we are one of the highest volumes for the Vaccines for Children's program for immunizing our clients, and as well as having back-to-school sports physicals, and doing those not during the operating days or standard days of practice, which is Monday through Friday, 8 to 5. It's the staff is dedicated and does that on a weekend, giving up their times. But not only the staff, but the providers, meeting the clients where they're at, doing the reach out and read, and having those community involvements in terms of Williams Wells Brown is right up the street. It has the connectivity with working with their resource officer and their resource communities to go there and when they have sponsored community activities. How well can you be connected? A lot of times you may not see UK representation at some of these type of venues where it's right in the school system, or partnering with the Lyric Theater, which is right across the street, and piggybacking in on some of those avenues. I just mentioned a few of the things that we've done in terms of meeting the client where they're at, and things that we have recently fought for and got and have had the support of our upper leadership and management, is having a pharmacist, a full-time pharmacist come in, closing some of those care gaps with the reentry issue of hospitalization, because there may not have been adherence to the medical need, but it could be they've changed insurance plan or they don't know where they can go. So with having a full-time pharmacist, that works directly with the provider and can work with the client and help with education, because they may not have transportation to get to the Barnstable Brown, where it has a well-renowned and offers programs, but we offer those things out of our lending of support and bridging. And the pharmacy program has offered a meds to clinic service, where similar to Meds to Bed, where patient, when they come in for their medical provider appointment, they can have their supply of medications readily at hand. So those are futuristic goals that are achievable, and I just cited a few. And just remember that when you're working with your community partners and being downtown, those are some of the innovative ways that we not only connect, but we could be used as the meeting place for some of the outreach things that were discussed, where you can bring a mobile unit because we have a well-lit parking lot, thanks to UK Healthcare, and offering security for not only the staff but the surrounding community, and be that beacon and spokesperson for the community, and not forget that. So in moving forward, that's where we need to be. Have these conversations on what works, and not stifling, oh, you're late, or stereotyping, why didn't you make it here when you knew you needed to be here. Have that person to be present, to have that soft conversation and understanding, and meet them in an empathetic way with more of a pitiful way of saying, oh, well, yeah, she's just late again. Just like you talk about in the hospital setting. Do you talk about HIPAA or being compliant? You want to give respect and dignity to people who might have a diverse cultural competency. So in moving forward, we celebrate where we've been and how we need to continue on in meeting the needs at where they're at.
That is wonderful. So many things there, and I know you said you talked about a few things. I'll air quotes there, that Nancy stated, a few things. I lost count after about 4 or 5, but these are excellent programs. But I believe what Nancy has pointed out to us and the team is the fact that we have been innovative with a group, and we have to remember that every patient, just as Dr. Newman talked about with the 3 Ps, every patient deserves a fair opportunity to reach their highest potential in healthcare outcomes. And Nancy and the leadership team out there at Polk Dalton has made sure that every patient that shows up at Polk Dalton has a fair opportunity. Oh my goodness. And the community health worker, Karen, right?
Yes, ma'am.
And how long does Karen be?
Karen doubles as she is our full-time X-ray technician, and she has taken the initiative to go for the training that is offered through UK Healthcare and Hazard Friends program,
yes.
and being a certified community health worker. So if you're not doing X-rays on a continuous, ongoing basis, be able to pull aside, be a friendly face, have
Yes.
somebody that can look like me and talk in the language I understand.
Well, Karen has also mentioned when we've been out at Polk Dalton Clinic that she's been out mowing her lawn, and having consultations with patients in the front yard because she lives in the community with the patients that we serve. It's really a beautiful model, and Karen's a beautiful individual, and it's so true, Nancy. I mean, so kudos to the work we're doing and where we're going to go, because we have to continue to be deliberate, intentional, as Dr. Newman stated, strategic, and inclusive. So thank you so much for sharing that, Nancy. So now we're going to shift gears, because it's always important, obviously, when we have these discussions and we're talking about turning points in our service, is to hear the voice of not just the patient, which is very critical, but also the employee. So what I want to talk about now is in 2016, UK Healthcare took next steps in specialized care for LGBTQ+ patients by forming Transform Health. This group of dedicated providers, and that they are, specialize in high-quality healthcare that targets the needs of Kentucky's LGBTQ+ community, while at the same time, and this is pretty incredible because Dr. Kisa Fallon-Bennett does, and Dr. Marks out there, they do a beautiful job of this, while at the same time training students and residents in specific healthcare needs of this population. So it's really incredible. These clinics are located, as you know, many of you will know, at UK Healthcare Turflin, Phyllis D. Corbett Community Center in Wilmore, and also the University Health Services for UK students. And it provides a place where patients can feel safe and receive evidence-based care, and to Nancy's point, where patients are seen, heard, understood, but respected. Okay? So at this time, what I would like to do is have Caleb talk to us about sharing with our viewers what this means from their perspective, but what does this mean in terms of sense of connection, belonging, and psychological safety? So Caleb.
Thank you, Dr. Talbert. So as she said, I am a patient of Transform Health and an employee here at UK. I am an openly transgender male with he, his pronouns. And as a patient at Transform Health, I cannot tell you what it means to me to be seen. That's the biggest thing. I'm seen there. I don't have to educate my provider. She understands. I do see Dr. Kisa Fallon-Bennett. She is my lifesaver, I like to say. Before that, I come from a very small town in eastern Kentucky. I've been on hormones for going on 10 years, and I never would have thought when I was younger that we would have a clinic in Kentucky that would be just for, LGBTQ patients. And to have that and to get to represent them, it means the world to me as a patient, as an employee. They do tabling events at Pride, like you were saying, meeting the patient where they're at. They come, she educates, she lets us participate in our care, and even offers the opportunity to help in those educations and panels such as this. UK has come so long in the 6 years as I've been here. We've grown every year, and I can't wait to see what we have coming next, especially with Transform Health, because now they have the networking with other providers at UK who are also being trained. We have our OBGYN, Dr. Zachman, who is amazing. We have Dr. Lau in plastic surgery, and just the outreach that they are doing and opening all these additional clinics. And I know they're in the process of starting a scholarship as well for LGBT providers. So I look forward to seeing what we can do.
Thank you, Caleb, so much. And I'm not sure if many of you know this, but Caleb works with me so much, and he's been really fabulous to be on several other panels with me as I've gone out to educate individuals about the LGBTQ+ community, because I always say there's nothing like hearing it from the lived experience of someone in the community. Yes, I've done a lot of research and I've learned a lot from great people. I consider myself an advocate, but I understand I need to be called that by people who identify in the community. But I'm learning a lot, and Caleb, I just appreciate it, because every time in front of a new group, it's like coming out all over again. But I really appreciate him sharing his story and being a part of today's panel. So thank you so much. And Dr. Kisa Fallon-Bennett is pretty fab. She's pretty fab. So thank you, Caleb, for sharing. So last but not least, we're going to shift now to Dr. Hema Hoke, and last but not least. So we're really wanting to shed a light on our mental health population and our path forward. So the Commonwealth of Kentucky, as many of you know, transferred management of Eastern State Hospital to UK Healthcare in 2013. I was fortunate enough to be a part of that transition with some colleagues here at the hospital. But Eastern State has been in operation since 1824. Eastern State is the second oldest continually operating psychiatric facility in the country. Just a little bit of information that you might want to have or didn't know. But extensive planning when we took over in 2013 went into ensuring a safe transition of patients from the old campus on Newtown Pike to the new $129 million state-of-the-art facility at UK's Coldstream Research Campus on Bulliard Road. So UK Healthcare answered the call from the state to manage Eastern State Hospital to ensure that we were taking care of our most vulnerable patients. To ensure care for these patients, it was important to have a smooth transition from the old location to the new. So what we want to talk about is we've given a little bit of history in terms of mental health and as it relates to Eastern State, but we want to have what Dr. Rahima Hoke now will share with us is some history on the call to action as it relates to where we're going next. Because Dr. Rahima Hoke and I have had very exciting conversations. So I'm very excited for you all to hear what he has to say about our next crucial turning point to meet the growing needs of mental health needs of individuals in the Commonwealth.
Thank you so much for inviting me to be part of this crucial conversation today. And reflecting on what other people have said before me, just the importance of being connected to a community that's looking forward to change and thinking critically about how to get to that change is really important. So I just want to acknowledge all the people that went before me. But I also want to say that with respect to Eastern State Hospital, 5 years ago when I was thinking about taking the job here at the University of Kentucky, I thought to myself, any community that wants to invest in providing high quality care for some of the most vulnerable people in the community, people with serious mental illness, like they did with building Eastern State Hospital, is a place that I really wanted to be. And I will acknowledge that this was a real partnership between the community and the state, initially getting it to come together with a real concern about advocacy and about the advocacy groups within the state trying to bring all those points of view together. And I think it was an exceptional opportunity when the University of Kentucky was able to come and do the management for Eastern State Hospital and provide a really important platform to provide that care. And when I think about turning points and I think about mental health in general, I can't help but think about COVID. And in the wake of the COVID pandemic, I think we've all felt the mental health epidemic. And in that epidemic, we've all been aware that access to care has become a really crucial part. Access within the community and particularly within institutions that provide care. And I do want to acknowledge that I think what it has demonstrated, this feeling of need for access, is a feeling within the community that mental health care is health care, and that we're not separate from it, but we're one and the same. And that integrated feeling is going to be extremely important moving forward, not only because it's the right thing to do, but for the generation of kids who are growing up with cell phone and social media, they know it is the thing to do. That is what they're going to expect from their healthcare delivery systems. So I want to say that to meet this growing need of access in a sort of different world, the post-COVID world, I think the Department of Psychiatry, in collaboration with UK Healthcare, with the College of Medicine, with the state, with local and community leaders, have tried to develop a path forward to meet this need. And probably the place that I think is the most urgent is among children and adolescents. In the course of my career, I have never seen the need for behavioral health care the way it's needed now for children and adolescents. We, unfortunately, didn't see it coming. And the system of care did not know that this was going to be upon us. But like any good turning point, it's an opportunity to look backwards, to see where we were, and consider forward where we can go. And to that point, I think there have been some great investments by UK Healthcare to try to meet that growing need. One is a state-of-the-art child and adolescent unit that will be coming online sometime in the spring that is using, trauma-informed care to provide, what's needed for a population of kids who are really in need. So that's very exciting. But there's also an understanding that we want to provide care in the least restrictive environment for children. We don't want them to be in an inpatient hospital any longer than they need to be. So to help them step down to the next level, there's been a development of an intensive outpatient program to help children and their families get the care that they need in the community and so they can stay in school. And that's being done in connection, obviously within the UK Healthcare family, but targeted with the Department of Pediatrics as well. And in collaboration with the Department of Pediatrics, we're also doing work to help provide integrated care for people who have developmental disorders. And that population of kids who have autism or other types of issues like that can be very difficult for the families and for the children. And allowing them to get one-stop shopping where they can meet therapists and psychiatrists and pediatricians all at one time is extremely important. So that's coming online as well. And then finally, I want to make the point that we know that the most important thing is to have community providers to provide that access. And the UK Healthcare, the College of Medicine, the Department of Psychiatry have been leaders in training training residents. Sometimes it feels like kids given my age. Training residents to be pediatricians, psychiatrists, and child psychiatrists. And that program has been around for the last 35 years. And people in that program who've graduated have been leaders in psychiatry in Kentucky, have stayed in Kentucky, and we'd like that to be, to grow that even further. And so there is a idea afoot to expand and increase the number of residents in that program. The other thing I just want to draw your attention to is that in the in the wake of the COVID pandemic, for adults, it's also been very challenging, and it's manifested itself in a different sort of way with increased substance use behaviors. In particular, alcohol use has gone up considerably in the population. So to meet that need as well, in collaboration with the College of Medicine in UK, UK Healthcare and the state, the Department of Psychiatry set up a what we call the SMART Clinic, which helps people with substance use disorders. And in that clinic, it's a interdisciplinary clinic that uses a lot of different models to help people stay engaged in care. And what I would say is, when I came here, it seemed like we had 10 patients in care in the Department of Psychiatry that had substance use disorders and co-occurring psychiatric disorders. But I'm happy to report now we have over 280 unique patients getting care in the SMART Clinic, which is great. And we now have the capability of providing hepatitis C treatment and primary care in collaboration with the Department of Internal Medicine. And to build upon that and build upon the need, we also have a residency training program that includes internal medicine and psychiatry. Again, because we know that this is an important area that we have to work hard to address. And I'll finish this by saying it all comes down to community. It all comes down to community involvement. And we're only as good, right, in the care that we deliver as we are connecting to the community that we live in. And that's what I heard so strongly with all the people that came before me. And so I'm really glad to be part of this conversation. And thank you for including me.
Incredible. What a great way. I said last but not least, right? So I love what you said about it boils down to community and community involvement and going along with to create these innovative ways to meet the needs of all these populations discussed, but specifically looking at mental health. And these are some incredible things with the SMART Clinic, trauma-informed care for the children, the least restrictive environment, and increasing our outpatient presence, because you're looking at the trends and the needs of the people we're serving. So thank you, Dr. Himmelhoek. Thank you for that great ending to this. I mean, we will open it up before we close out, we still have a few minutes to see if any of the audience has any questions today. Well, here they go. So the first question is, what DEI progress would you like to see in the next 5 to 10 years to bring additional value to our patient care? Maybe I can ask that. And I want to remind people that Dr. Newman is still here, and I may be calling on him from time to time to answer some of these questions. So I would say that the story of each of these individuals plays a role in that, and that when we look at DEI progress, and what I would like to see is that it be about the 3 Ps. I'll go back to what Dr. Newman said. It's about our people. So how are we positioning our people, our workforce, to be successful, to succeed, to be promotable, to have fair opportunities, to be their best selves, to be, as Caleb said, to be seen, heard, and respected and treated with dignity. So it's about our people. It's about our patients. So how do we meet them where they are? Because it's not all about bricks and mortar. So that's the other P. And it's about that third P, which is the overarching purpose, which is really talking about how do we create this environment that's beneficial for our people and our patients, where everybody has an equitable and fair opportunity to meet their best health outcomes, regardless of who you are, how you identify, but also to reach your life success as an employee. We want to be an employer of choice. We want to be the place of choice for patients to come. So it's really all working together, and it should not be an either or, but a both and. And again, Dr. Newman's still here, so anytime he wants to come up, you just come right up here, Dr. Newman.
Dr. Talbert, I would add to that that I think what I'd like to see over the next 5 to 10 years is that we increase our representation. And what you see here is a diverse group of panelists representing a lot of different segments of our population, but we cannot overemphasize the need to be able to have patients that see people that look like them, think like them. It's very, very important to them. I love the concept of the front porch. I grew up with a front porch, and the front porch is friendly, to come and talk and feel comfortable. So I think that the push for diversifying and getting representation of providers that look like them is very, very important. And multiple times they talked about community health workers, critical for the success of our healthcare going forward. We have to have people in the community to engage our populations.
Love it. Great ad, great ad. Absolutely, representation, and that goes into those 3 Ps, the people. It's about how are we, and we have to retain to recruit. So people need to see people who look like them to recruit people so that they know they are coming into a community that embraces diversity. So I love that. Thank you, Dr. Conway.
I think it's often said in the healthcare community is you want to mirror the population that you serve. And I believe if we were just to use as a benchmark, what is the percentage of minorities here in Lexington, and how close are we to that in our healthcare organization? That would be a starting point, I think, to shoot for as a target.
I love it. I love it. Great feedback, Tim. I love that. That is true, right? Representation. Anyone else? Because it's free for all with the panelists. All of you are super fabulous, so feel free.
I'll just add that, when I guess we consider DEI, I just want to also include people with mental health issues as well. And I just want to acknowledge that there's a long history of stigmatization against people, particularly people with serious mental illness. But I just want to call out that there's also resilience in that people who've had these these life changes, let's say, that for many, resilience is a big part of it. And to acknowledge the resilience and to acknowledge what people can accomplish is really important, even more so than the name that we usually give as a diagnosis. So just wanting to put that out there, and I think that's changing, and I'm hoping it will change even more. And can I just share one quick story? I think we have some time. I was on a conversation with a colleague of mine who said that NIH just gave a grant to a, whoa. Okay, well that emphasizes this interesting point.
This is always very fabulous for me. I love this when it happens during the crucial conversations.
Well,
Is that an alarm?
Fire, I think it's for fire. Not, hopefully not,
Code red, Pad A, 1105,
typically they do that.
pull station. Your 11th floor, room A11. Your attention please. Code red, Pavilion 7S05, pull station.
Okay, we have 29, yeah, because it's done. Okay, finish your fabulous story.
Well, I'll try to just make it quick, which is this person had, who is a PhD psychologist, as a teenager, had a psychotic episode and benefited greatly from a early onset treatment of psychosis program, was able to get her PhD and successfully got an NIH grant that is evaluating what type of work environments should people who have psychotic disorders receive in the community. Historically, they haven't been too great. And her point is maybe we should be rethinking that, and that people should be able to strive or stretch for other types of employment. So just want to put that out there because I thought that was really important and maybe a sea change for how we're thinking about that important group of people.
Right, I love it. What a great, and we are at time, so I will close us out because the fire alarm seems to want to compete with us. So thank you for joining us today, and thank you to all of our panelists, Dr. Newman. This has been fabulous. Thank you all. You did a beautiful job. Thank you. Yes. Oh, my.